Dr. Leah, a new mom asks, one of the changes to my body after pregnancy is mom butt. Are there exercises I can do to get my old butt back?
My best friend, who is very blessed in the booty department, just had a child, and she actually brought this up. Originally, I thought she was completely crazy, but there is a truth, and here's why. As you gain weight in pregnancy, that extra weight is unevenly distributed throughout your body. As a result, this extra pressure shifts the center of your gravity forward. And to compensate, your spine and your pelvis have to tilt forward to keep you upright. And then you start to have an anterior pelvic tilt. There was actually a study where researchers did an EMG, which measures muscle response or electrical activity, and the response in nerves and stimulation of the muscle. They examined and found that the activation of the lumbar spine and pelvic extensor muscles compared to women that had never given birth. And unsurprisingly, the body made postural adaptations in response to the increased abdominal volume. Additionally, during pregnancy, you may overstretch your muscles that support your posture, which causes short, tight anterior muscles. This leads to less activation of your upper back, abdominal, and glute muscles, which causes muscle loss and weakness. Plus, you're overactivating some muscles like your hip flexors. Also, hormone changes could also affect your body during pregnancy. Your body releases more relaxin. This prepares a woman for birth by relaxing the muscles and tendons and ligaments near your pelvis. But it can also cause your muscles to stretch and widen, potentially changing the shape of your butt. Again, many people become less active during their pregnancy, so they're not exercising their glutes as often and probably having prolonged bouts of sitting, which typically encourages that forward tilted pelvis and increase your risk of low back pain. Lastly, breastfeeding takes up a lot of energy. Women will need an additional 300 to 500 calories per day just to keep up with the increased energy demands of breastfeeding. So it's not uncommon for women to lose fat and muscle mass from breastfeeding, leaving kind of a flabby appearance. But there are things you can do. Avoid exercises that train your hip flexors, like cycling. This can encourage bad posture and make glute muscles inactive, which will contribute to saggy mom butt. There are things you can do. Standing quadricep stretches, which also then are going to stretch your hip flexors by bringing your heel towards your glute while keeping your pelvis neutral. It's important to make sure that you're squeezing your glute muscle of that leg and that you're pushing your pelvis forward. Also, avoid sitting for several hours a day. It only worsens the muscle imbalances that you're getting from pregnancy. So do some basic glute exercises. There are many that you can do at home, like hip thrusts, squats, lunges, or fire hydrants.